I'm C1, and this is The Christopher Show. And today I want to talk to you about Clover Health and the 2024 Citi Global Healthcare Conference that just transpired with Peter Kuipers on December 3rd. He's the CFO for Clover Health. What is Clover Health? Let's jump right in. It's AI for healthcare. It's led by the CEO, Andrew Toy. He's noble in a time where we see selfish healthcare providers trying to cut costs or trying to deny claims. He's very passionate about what Clover Assistant does because he lost his father at a young age. When he lost his father, they checked him for certain genetic markers, and because of that, he credits that early detection with why he's still here today. So Clover Assistant kind of does the same thing. It does early detection of health problems in its members or in the members of Clover Health. And by doing so, it improves their quality of life and it improves the cost of care. It lowers that cost of care, so it makes it cheaper. So let's jump right in. They recently got upgraded to 4 stars from 3.5 stars. While they were getting upgraded, their competitors got downgraded. This is a benefit to Clover Health because it allows them to offer benefits that their competitors won't be able to offer. In addition to that, they're able to keep the out-of-pocket cost for their members cheaper than other providers than their competitors will be able to do. So annual enrollment period just ended December 7th. So now we're waiting for those numbers to come out to see how many members they added to their already existing 81,000 members that they have in New Jersey. They have a 10% market share in New Jersey, so we'll get those numbers soon. Then open enrollment opens in January, and that will run from January to March. So we'll see new members joining through there as well, especially when current subscribers to other providers wind up realizing that they're not getting the same benefits they were getting previously. And in addition to that, it's costing them more. These are our 2 busiest times a year, Q4 and Q1. So I'm looking forward to see what numbers come out of this. There is a plan finder that will allow the subscribers out there to compare plan benefits and cost. So they're going to see us up at 4.0. They'll see the other providers down at 3.5, and they'll make their decision there. Let's talk about capitalization, self-funding, expansion. What are they doing? Peter Kuipers mentioned time and again that he sees multi-year growth, and more than that, they've achieved growth, and now they're looking at accelerating growth and driving that growth. They're going to do that through 2 things. They're going to do that through their current plans that they have, Clover Assistant and Clover Home Healthcare, but then they also have a software that they took, their proprietary internal software. They've also made it available for other providers, so they're going to generate revenue through that stream as well. So we have two revenue streams. The second one is in the early phases of that stream, so we're going to be seeing those numbers come soon as well. Their current financial position is they have $530 million in cash equivalents and cash on hand. 200 plus million of that is unregulated cash. So they are able to self-fund. They're not going to have to go back to the markets. They're not going to have to take out debt. They're able to continue to do so with the current cash they have on hand. In addition to that, they proved profitability at 3.5 stars. Now that they're upgraded to 4 stars, we're going to see more profitability, which means that it is self-funding going forward for both the growth of their members as well as the new providers that we're going to be bringing on through Counterpart Health. Existing revenue trends throughout 2024, they upgraded EBITDA time and again, and so we have that upgraded throughout the year. And in addition to that, they managed to get GAAP profitable with a 3.5 star rating. So that's where we're going to see the benefits as we roll into 4 stars. That's where we're going to see growth into 2025 and 2026 that come from that star upgrade. It has empowered us to do a lot more. The existing revenue stream that they have, as I said, it's 81,000 members. It comes from Clover Assistant and Clover Home Health. Clover Home Care, and we're going to see growth in that New Jersey market as those annual enrollment numbers come out. I'm excited to see those. Where are they expanding to? They're going to expand to Georgia, South Carolina, and Texas. Once they grow into those markets, they're going to use once they enter into those markets, they're going to use the existing marketing strategy that they have, and they're going to realize efficiencies that come from that growth. So we're going to see a lot of growth in those 3 markets as well. It's the same strategy as New Jersey. One of the biggest revenue generators is going to be the people who switch to us or switch to Clover Health because they have existing medical history that can instantly be loaded in. So we'll be able to help them improve their quality of care and their cost of care and lower their cost of care, and they'll see benefits as well. So we're going to have benefits for existing members as well as the new members that come in. So what is the sales cycle like for Counterpart Health? Basically, they have to identify the decision makers, obtain clinical approval, obtain C-suite approval, and then implementation is really the quickest part of all of that. So once they've gotten through all of the approvals and the buy-ins, they're able to see recognize contracts and sign those contracts. So Iowa Clinic partnership was signed September 3rd. If we take the 1-year cycle, that means they actually started working on that deal in 2023. They patented the software in August 2023, so that makes sense that it would be they would start diving into those markets and trying to expand Counterpart Health in 2023 and into 2024. Peter Kuipers mentioned time and again they have a very robust pipeline. Not only did he mention it, but Andrew mentioned it on the earnings call as well. They're also expanding. They've been hiring new workforce. They have new implementation experts, new engineers, new commercial reps. So they're growing their workforce. We're going to see some of the benefits of that, and we'll start to see some of those new partnerships come to the table. Managing costs, they're going to continue to increase their new members, generate new revenue through that, and then that again drives into the self-funding element in it. And they're also going to continue to manage their costs by improving their best-in-class industry software. So are there any incoming administration challenges? No, because both Republicans and Democrats support saving or improvement in the cost of care for Americans. AI algorithm, what makes it better? It's a patented tool. It's very powerful. It's quick to implement. It's designed by physicians for physicians, which makes it a very elegant user interface that physicians like. So that drives an intensity of usage increase, and it connects over 100 data sources, and it helps with care management efficiencies because of the amount of data that we're bringing into it. Added capabilities that they can do in the future will help cut cost, and it'll help identify medical needs of patients sooner, which is really the noble part of the cause, and the most important part of the whole story is improving quality of life for their members. With that, thank you very much for listening today. This has been Christopher. This has been C1 from The Christopher Show, and this has been about Clover Health. Thank you for listening.